So today I'm just going to talk about MTBI, or mild traumatic brain injury. So this isn't going to be about medical advice or anything that's sort of specifically to that, because I'm not a medical doctor. I'm not going to pretend to be one. This is kind of more about just exploring it a little bit, trying to understand the impact that some of the cofactors have, and then trying to develop some of our own behaviours so that we can reduce the risks that we'll end up with sort of issues with cognitive disease or degeneration later in life. So from this point forward, I'll just kind of call it cognitive disease. So it sort of leads to sort of your Alzheimer's, dementia, those sort of things, or general cognitive dysfunction, degeneration and disease sort of thing. So we'll just call it cognitive disease or degeneration. So what I'm sort of going to talk about is more in line with the military blast exposure. So there's been a fair bit of work, however, outside of that in sport with concussions, head knocks, those sort of things. Rates are pretty high within inmates for kind of being bashed, essentially. It's also pretty high with domestic violence victims, one for physical abuse and assaults around the head, and two for strangulation. So they've sort of been shown to be risk factors, and it's higher in those populations. It's also a general risk factor, or it's a general sort of cause of increased death, or it's one of the leading causes of death as people age. So there's a fair few factors around it, but it is a bit of an aging disease as well. So when it comes to the military side of things, there's been a fair bit of research that looks around blast exposure. So when I'm talking about blast exposure, that's both the kind of explosives, so where I was with sort of 20 years in the military, and a lot of that being within the environment where we were doing a lot of blasts, a lot of explosives, is kind of breaching, those sort of things where you're up close to a explosive device that's used to punch a hole in a wall or a door or gain entry. And then there's kind of the sort of heavy weapons that you use, which may have a blast effect to it. Then there's heavy caliber weapons, and then there's kind of your small arms, as well as kind of your artillery, these sort of things, which all cause a sort of explosion, which has an overpressure and percussive effect, which causes damage to the brain. So some of these weapons have different damage profiles as well. So some of the explosives can be more of a pushing type of damage, where some of these small arms can be more cutting type of damage, and it has a little bit of different impact on the way on the way that causes damage within the brain. So there's kind of exposure to those different things, and then there's the cumulative effect of combined exposure. So there is some devices out there which can measure those percussive effects, or that sort of waveform and the impact that blast is having, so that you can sort of determine how much exposure you're getting, okay? And then there's work being done to try and work out what's a minimum safe exposure, so that we can maintain competency and ability within these skills, because there's still that need or that requirement to be able to train these skills so you're effective and efficient with them, so that you don't transfer the liability to operations from sort of that training liability or under preparing. So when it comes to the environment itself, there's a couple of things that we can sort of look at. So the equipment that we wear has a bit of an impact as well. So there has been some studies looking at helmets, and different types of helmets can actually cause reverberation of that blast wave within inside the skull. So it can bounce around doing sort of repeated damage, or sort of a lot more damage than helmets that just kind of transfer or allow that wave pressure to go through. And then there's different equipment which will kind of contain it, and then there's the environment. So different environments will might contain that blast or that percussive effect more so than other environments where it's allowed to dissipate over a bigger area or kind of out of that environment. And then there's kind of the way that we set our training up within proximity of that blast. So this is kind of something that I was guilty with, and I've seen within the environments that I was in, was people sort of standing too close to these devices when they go off. So there's a little bit of ego and a few other things that are at play there, but it's probably a little bit around being a bit smarter and making sure we set up the training environment and we've got the right equipment, so that we reduce the effects and we're not creating any unnecessary damage or exposure. So when it sort of comes to the cofactors, so to understand the impact of blast, we need to be able to kind of isolate it, but it's difficult to isolate blast exposure or impacts within the environments that we're in. So what I sort of mean by that is that we want to be able to determine how much accumulative load an individual can kind of carry or can endure or be exposed to. Obviously we don't know whether that's going to be positive or negative until they're older, because it's hard to diagnose or determine. So it does make it a little bit complicated. Like some of the cofactors that can complicate understanding this, and it's very hard to sort of account for, is firstly sleep. So sleep within itself is a risk factor for cognitive degeneration. So if we've got a situation where people have less sleep or poor sleep routines, or they're underslept, sleep deprived, then that's going to magnify the impact of blast. Okay, so you're going to have two covariates, and we don't really know which one may be worse, potentially blast in the short term, but maybe sleep in the long term. And then there's exercise. So exercise has shown to be a kind of mitigating factor or a buffering factor, and aerobic fitness allows us to kind of improve the ability for the brain to recover. So fitness level is a cofactor in here. Okay, and then there's nutrition. So bad nutrition is a risk factor for cognitive degeneration over time. Okay, there's links between type 2 diabetes, so nutrition plays a role in the type of foods we eat. And then there's alcohol. So alcohol is another big one. So alcohol, again, in isolation is a risk factor, but when that's combined with exposure to explosives, that's going to have a confounding impact. So you think if you go out, you do some training, you're exposed to a blast, you come back, you have a number of beers and you don't sleep, okay, that's going to have a magnifying effect on the blast, much more than what the blast exposure itself would. And unfortunately, there is a bit of a drinking culture within the military. So there's the impact of alcohol, and it impacts your sleep anyway. So as soon as you start drinking, your sleep is impacted. So you've got both of those factors involved. And then there's kind of drug use. So it's kind of often not spoken about, but it's definitely there. And anyone that's been in the military knows that it's kind of an underlying sort of element, is that a lot of your social drugs have an impact as well. So that's your cocaine, your marijuana, your MDMA, those sort of things they're a negative risk factor, as well as a lot of your performance enhancing drugs, okay, can have impacts as well, but they're not as well sort of studied, or I haven't seen the research on that. I just know that they're a risk factor. So they're sort of the things that can go on to be covariates or add to the complexity of trying to understand the impact of exposure. And it also adds increasing risk factors to you. So the more you do those things, the more likely you are to suffer from a degenerative disease as you age. And then there's kind of your history of sports. So the more concussions you've had, the more contact sport you played, the more sort of impacts you've had as sort of a young person growing up, it increases the chances. So history plays a role in it as well. So these are all things that kind of complicate the situation. So if we want to kind of understand the impact of blasts themselves, then you really need to be able to account for all these cofactors. But unfortunately, and it's unlikely, that people are going to record their sleep. People are unlikely to record how much alcohol they're actually drinking during the week, after training, just in general, these sort of things. They're certainly not going to record the amount of drug use that they have, because they're probably going to get removed from the army anyway or kicked out. The exercise component, if they did more of that, or they sort of regulated their exercise, it would have better impact or a better buffering effect. And then even post-blast, and this was something that I was involved in sport in return to play from a head concussion, was doing progressive increases in exercise. So you weren't increasing, or you weren't kind of overloading them with exercise on the way back, because once they've had an injury, then you need to be able to progressively load them so that they're symptom free. And then even with weightlifting and these sort of things, anything that increases blood pressure through breath holds or anything like that is going to increase the damage and reduce the recovery time, or increase the recovery time. So both having good exercise habits and then doing a right return to work exercise program is going to reduce the long-term effects and sort of allow a better recovery time. Okay, and then when it comes to sort of diagnosis, unfortunately it's difficult to diagnose, and until we understand the actual exposure, it's going to be difficult to work out what is a safe exposure for somebody to have. So it's trying to find the balance between the sort of minimum exposure that we can give them, but still maintain that competency and currency in what they're doing. And then unfortunately, as far as the risk factors, or as far as diagnosis go, a lot of the issues we see in defence are actually overrepresented, because we've got this situation where people are financially incentivized to report things so that they can get payments, they can get welfare, they can get a pension, these sort of things. So there is a percentage, and unfortunately it's out there, that's going to present with these factors or sort of suggest they've got these symptoms when they may actually not have them. And that's going to prevent, or it's going to decrease the accurate understanding that we have of these mechanisms or what causes it, and then the way to treat that. So unfortunately it's a thing, and it's going to get in the way. So when it comes to decreasing the risk and these sort of things, it's kind of down to the organisation understanding what goes on, accepting the kind of risks, accepting the fact that it's there. And this has been something that's been spoken about for some time now. I've got a number of sort of peers, people that went through before me, or that I knew that were sort of above me, that had been in for a while, that have suffered from these diseases. They're showing signs of these diseases, these sort of things. Even myself hit a number of the high risk factors. So I definitely something that we've been looking at, and it's good to see more and more awareness getting pushed out there about it. But the organisation needs to sort of take some of its own, or take some acceptance and responsibility to make sure it's not part of a problem. And during my career, I've been forced to expose myself to unnecessary blasts just because of bureaucratic processes where we couldn't give ammunition back because of the way the organisation is set up. So we've exposed ourselves to unnecessary risk and blast exposure. So there's kind of that responsibility, or accepting responsibility. Okay. Also need to make sure that we don't become overprotective, so that the ability to perform operationally suffers. And over time, some of these things are potentially going to be automated, so some of the risk factors will sort of be taken care of. But we need to make sure that risk isn't transferred to operational circumstances. So it's not doing any unnecessary training, doing the training that is necessary, so that we've got that nice balance, or we're reducing the risk. Okay, as far as individual behaviours, and this is where we can get most of the benefit, is controlling the things that we can control. So making sure that we've got a good sleep habit, we've got good sleep behaviours, and particularly after we've been exposed in that recovery period, we're getting the sleep so the brain can recover from any damage that it's received. Okay, there's exercise behaviours that we can control, so making sure that we've got a good exercise habit, ritual behaviour. And then after blast exposure, we're making sure that we're not flogging ourselves up. And even as the organisation, making sure it's not unnecessarily beating people up after they've been exposed. Nutrition is another thing that we can take care of. Unfortunately, within the military, their nutrition is kind of outsourced to the cheapest bidder, so it's not that effective, or it's not that actually nutritious or good. But we can take care of our own under a number of circumstances, make sure that we're avoiding highly processed foods, we're avoiding inflammatory foods, we're trying to eat good foods that give us a good gut microbiome profile, because all of these things reduce the risk. So we can make sure that what we're putting in our mouth isn't going to impact our brain or make it any worse. Okay, so after blast exposure, we can make sure we're looking after all of those things. We can kind of make sure we're sleeping. We can kind of put ourselves in the best position to recover. And if you've got impact or effects of it, go and see somebody, get the right treatment, make sure that you've got a reduced activity period until you're symptom free and beyond. And we want to make sure that we're looking after ourselves just in lifestyle, because there is evidence that shows that cognitive degeneration does have a bit of an association with metabolic dysfunction or kind of energy dysfunction, particularly within the brain when it comes to the kind of mitochondria in there. Okay, so we want to make sure that we're getting all these things done and that we're looking after ourselves. And that includes doing some things around challenging your brain or consistently learning. So learning a new language, learning a musical instrument, these sort of things can actually help the brain grow, okay, and decrease our chances of getting cognitive degenerative disease, okay. Probably post-blast, give it rest, don't challenge your brain, okay, but we can make sure that we're doing that. There is a little bit of research that shows that preconditioning can be effective, so sort of having small blasts on the way up to getting larger blasts, so kind of like a conditioning effect that you would see similar to exercise or fitness, is that we can actually precondition ourselves. Obviously, you want to make sure that that's in a progressive, safe manner if it's something that you can be in control of or look at. And then kind of another thing we can look at is mental relaxation, particularly after exposure to a blast, just trying to give ourselves the best chances of rest, recovery, and making sure that brain can repair any damage that's been done, because we don't want to continually keep adding stresses to it that cause that cumulative load, because a lot of the evidence shows that it's a cumulative load over time, okay, without proper rest, that can increase our risks of getting sort of cognitive degeneration disease. So that's kind of exploring a few things around it. I hope there's some of the stuff in there that was kind of useful or helpful. Ultimately, it's up to us to look after ourselves as the first point, and then kind of lobby the organisation to make sure it's doing the best it can for us. So I appreciate your time. Thanks for listening. If you've got any questions, please reach out. There's certainly some people that are more informed on this, and I'll try and interview them or speak to some of them in the future so we can get a bit more of an in-depth understanding. So I appreciate your time. Thanks for stopping by, and look forward to the next podcast.